You mean you gotta put poison in me to kill something that's poison in my system? Is that right? Welcome everybody to another episode of I Dream of Ned. I am your host, Keilandcurtis, and today what we're going to be discussing is chemotherapy. I myself have colon cancer with transfer to the liver. It was imperative for me to get chemotherapy during my initial diagnosis. I had a small window of opportunity to make it, and my doctors got it right the first time, and so I'm still here after getting told that I would not make it throughout the night, then also being told that once I get out this hospital, I only had 30 days to live. So, but it is crazy though. I'm pumping poison in my body in order to get rid of bad substances within my body. It doesn't compute, but we're going to talk about the ups and downs of it. Mostly the downs, because there's no real up to it. Once you get chemotherapy, you're sick. Symptoms include constant runny nose, hard stool, constipation. You have throat issues. You can't sleep at night at sometimes. Like, I've had chemotherapy and went 24 hours, 24, 35, 40 hours without taking a nap straight. You get things like nausea, vomiting, your hair fall out. Thankfully, my hair still in, but it thinned out. It's like very, very thin and flaky. Me personally, after I get a dose of chemotherapy and I leave the hospital, my eyes are very blurry. I'm very shaky. Had loss of balance, and I tried to sleep it off. I might get home 4 or 5 in the afternoon after being at the chemotherapy office all day, and I just lay it down. I might do an insure and lay it down because I'm nauseated, so I can't really put nothing solid on my stomach. So I'm literally on a liquid diet. So chemotherapy is a beast, and I know a lot of people that have given up just off the chemotherapy alone, not even counting the symptoms included in the actual diagnosis itself. Just the strenuousness of chemotherapy could be very, very hard and take a toll on oneself. So without further ado, let's get into the video. So I'm out in Ann Arbor taking care of my chemotherapy. Stay tuned. Ready?
Okay. Okay, good return.
Alright, so what you saw earlier was them sticking a needle in my chest. It was about yay big. And that's how they draw my blood, give me my chemo. As you can see, the needle is in here in my chest. Alright, so now I'm at the point where I'm getting the chemotherapy. I'm plugged up through the chest. This goes into this machine here, and this machine here gives me the chemotherapy. So chemotherapy takes about 3-4 hours. So I'm gonna be sitting here for about 3-4 hours. I normally just go to sleep, watch a couple of YouTube videos, but for the most part, I just go to sleep. I ain't got time to be doing nothing else. And for all you that don't realize it, Cancer sucks ass. We started this process about 7 o'clock this morning and been, I'm not going to be done with this until like 3, 4 in the afternoon. So, fuck it. We do what we got to do. All right, so when you finish chemotherapy at the hospital, they set you up with a canister of chemotherapy that you wear in a fanny pack, and you take that home and you wear it for four days or so, 3 or 4 days. So this is my fanny pack. This is my canister of chemotherapy. It's empty now. I'm about to get disconnected. My wife is gonna pull the needle out of my chest. And this is the needle in my chest. You see the needle? Alright, so that's the full process of getting chemotherapy. Sucks ass. I feel sick during the chemotherapy, and then when I get the canister to take home, I feel sick with that. And when they disconnect, I feel sicker. So, about to lay it down.